We have Dr. Joseph Ladapo. He is the Florida Surgeon General. And then we have Dr. Ashley Mallon, and she is the Assistant Professor, Department of Epidemiology, College of Public Health and Health Professions, and College of Medicine at the University of Florida. And Dr. Griffin Cole, the International Academy of Oral Medicine and Toxicology. So, Dr. Ladapo, welcome and thank you for coming. And let's give a hand to our first two panelists, Dr. Johnson and Dr. Slack. Welcome.
Hey, thank you very much for having me here. Thank you for inviting me here. Thank you very much, and commissioners. Thank you for your interest in this issue and your care for your community. And you guys, this is an awesome showing with everyone out here. I hope people got to see the Little League game that was going on earlier too. This is a beautiful community. I hadn't been out here before. It's beautiful out here. I will talk briefly, and my colleagues, Dr. Mallon and Dr. Cole, will talk about some of the research. And Dr. Cole, of course, is a practicing dentist, and we'll talk about his dental experience. And I got to be honest, I don't mean this personally, but I had a lot of difficulty listening to that last presentation. And I had a lot of difficulty listening to it because I'm very sensitive to, just be honest, dishonesty. And when I say dishonesty, I mean that so I'm here because I care about your health. That's why I'm here. That's why I go to work. That's why I was a professor at UCLA. I took care of patients there. I was tenured at UCLA. I had 3 or 4 NIH grants when I left UCLA. And I got a call from the governor's office about taking the Surgeon General position. And I've got a wife and 3 boys, and we were very happy in Los Angeles. And I got this call, and I actually didn't know what to do, but my wife was very clear that I should take the position. And I took the position because I cared deeply about the issues that we were facing as a country and as a world in 2020. We uprooted our lives in Los Angeles and we moved to Florida. And that's why I do this job, because I care deeply about your health and about truth. And I'll be honest, I get physically sick when I'm in the presence of people who are trying to sell you on something, not because they care about you, but they care about the something that they're trying to sell you on. And I just got to be honest, and that's how I feel right now. I could care less whether the issue is fluoride or something else. The issue that matters is your health, my health, the health of our loved ones, the health of our kids, and how we make the best decisions that we can for them. And whatever happened in the past, fluoridation has been happening for decades in this country. And that's, fine. So people made decisions for whatever reasons that they thought were best. But at this point in time, that is not the right decision. That's the wrong decision. It's the wrong decision for health, because very plain and simple, without any of the long stories and the twists and the turns and the inside information and the gallantry and this and that, the bottom line is that you now have multiple studies, the vast majority of studies, that show very clearly an association between higher fluoride levels and neurotoxic harms, neuropsychiatric harms, lower IQ, more ADHD, more behavioral problems, more problems with executive function. And what populations are most sensitive? Children and pregnant moms. Like, what more do you need to know that you should take an action? I mean, what has to happen for you to know that that's not right? And we talk about risks and benefits.
Sure, dental health, very important. Fortunately, there are alternatives, right? There's toothpaste, there's mouthwash. This isn't expensive stuff. I mean, this is stuff that people of all income levels can afford, right? I mean, that is not an issue in this day and age. These things are widely available. They're inexpensive. That is an effective alternative. So, considering what's at stake and what we know now from the science, this is not complicated. The only way I can make it complicated is if I tell you a long-winded story and tell you to look over here and look over there, and this is the reason that happened, and spin you this yarn. That's how I can make it complicated. This is a very simple issue. The cost in terms of human health is far too high to be fooling around with this. I mean, it actually is reckless for anyone who's knowledgeable to have the information and to continue doing it. It's very simple. It doesn't need to be complicated. The complexity is the friend of people who don't want you to think with your brain and think with your intuition and just think with common sense. Complexity is their friend. This is a simple issue. We've had much more complex issues in the past, and there will be more complex issues in the future. But this is a very simple one. So at this point, I'm going to stop and let Dr. Mallon walk you through the research in an unbiased fashion so that you can be informed and make a decision.